You do not get used to this. Having terror attacks is something you don't get used to, and we should not get used to, and we should not accept.
Yeah.
And that doesn't matter if it happens in Israel, in Australia, or in anywhere else for that sake. And it's also doesn't matter who it's targeting. Those are life-changing events for so many people. For the victims, the direct victims, of course, but also for the communities that surround them. These types of events are actually derailing to so many people and to so many communities. And you cannot get used to it. You should not get used to it. So we have for the past 8 years since the hospital was established, but especially during the last 3 years, we've been trying again to see where we can impact and when we can use the knowledge and expertise that we have gained. And this is why very early on, like the next day after the massacre here happened, we were already in contact with the community here. We were already providing care through telemedicine to whomever needed it. The Australian system had challenges in responding, and not everybody that were affected, I would say, trusted the system or had availability. So we were there to offer that, and we actually treated more than 90 people, pediatric children and adults, over the first days after the massacre happened. And then in parallel, we prepared a delegation that came here that brought the expertise that we have treating victims, especially taking care of their mental status and preventing the development of post-traumatic stress disorders, to the community here that was challenged by an event that they actually didn't think or imagine it's going to happen. The culture of the Israeli innovation, it's not just in healthcare. Healthcare is a good example, but it's not just in healthcare. It's based on the fact that we are not afraid to make mistakes. We see failure as a feature in the process of development. Sometimes you would want your provider to be willing to take the risk for you. If you have a condition or a problem, a medical problem, that has no good solution, and that is sometimes the case, you would want your clinician to take the risk, of course, with you, share the opportunities with you, and to tell you, okay, despite the fact that your disease has not currently a cure, I'm willing to go and try and find a cure. I can't promise you it's going to help you, but at least I'm going to give you hope. And the motto of the Sheba Medical Centre, and of myself and of the teams that I work with, is hope without boundaries. It's without the physical boundaries, it's without discrimination to anyone, but it's also without limitation. We would do anything that we can, even if it's a 1 in a million chance, to provide hope to our patients, to try and give them the chance of getting better, again, in the best clinical manner possible. And I think that's what's special about the Israeli spirit. That's what's special about the Jewish spirit, especially when you have to do with doing good to other people. Okay, and that's part of what we are as a nation. And that's definitely the spirit of the excelling organization I run. We have went underground. We are a very big institution, 2,000 beds. It's a large institution in any scale, not just in Israeli scale. We see more than 2 million Israelis every year. In a 9 million people population of the country, you understand how significant and how big is the operation. We have 12,000 employees. So it's a huge operation. And to move all that from over the ground into the underground is a very challenging task. You might have a kind of a mental image that the underground is an organized structure of a hospital that's just underground, but no, it's the parking lots of the hospital. So once we hear that for all the rounds that we had with Iran, it was not that we had, like, we didn't know that's going to happen. We woke up as the rest of the nation woke up to sirens and to the alerts telling you there's a missile strike coming. And then we started moving the hospitals to the underground. And we did that very quickly and without affecting our services. We did not stop to operate. We did not stop our emergency department services. But more than that, we were the only institution in the country that did not stop any of the activity. But I think to us, one of the significant achievements around that is that, as I said earlier, Sheba is rated amongst the best 10 hospitals of the world. This rating is not, it's a very complex rating system that is based on a very complex metrics. You would expect that within the 3 years of war, where the hospital is underground, it'd be very hard to maintain the high level that is needed in order to be rated that high. But you know what happened during this 3 years? We moved up the grade, up the rating. When we got to be number 7, that's the highest, like that's the 2026 ranking, we're number 7. And that is kind of a good testimony as to the excellence of the organization, the way we see things, how we provide care for our patients. It is also has been much harder during these years for an Israeli institution to get international recognition. We got a lot of pushback from a lot of our collaborators that used to collaborate with us, with our researchers. We're a very, very strong research institute. At any given moment, there are more than 4,000 clinical trials going on at Sheba. Almost all of them are international. And it has been harder and harder for Israeli institutions, even to Sheba, to take part in these trials because people push back when they see that this is a Israel government institution. October 7th and 8th were very, very challenging in that sense of treating the patients that, or the casualties of the attack. But as of October 8th or 9th, we already understood that we need to prepare for the return of our hostages. We wanted to be very prepared and to provide top care, world-class care to them when they come back. But there's no textbook, there was not a guideline, no experience, okay? So we based what we know first on our professionals. I told you the best people in the world work for us. We gathered everything we could and we started training our teams. We ran a lot of simulations, we tried different protocols, and we came up with a method that was actually ready almost 10 days after the war started. So we were in place. Of course, we spread everything we learned and the protocols to the other hospitals in Israel. I thought I've seen it all. I was with family for the past 20 years, families and children in the hardest of conditions. I treated families that lost their kids after like immense struggle. I treated kids that were injured in accidents, in terror attacks, in just things that happened at home, children with burns, everything that you can imagine, I already saw as a professional, and I was there for them and their families. So treating the hostages might seem that could go, I already have the experience. And I have to tell you, this was a completely different experience. The level of emotion, what it demanded and required from us as caregivers was beyond anything we could have imagined, because the horrors and the terror and the abuse that these people have endured is just beyond belief. Some of the stories are already out there because they told them. But there is so much more than that. And we have seen them all. and we sat with them all, and we heard all of those stories. And we were there in those moments where they were united with their families. We were there in those moments when they understood what they have lost on October 7th. They entered the room and they looked around, and only part of their family was there. Their parents are not there. Their brothers and sisters are not there. Their children. Sorry.
No,
So
apology needed. Yeah.
these were moments where, again, nothing that I say can explain that. And despite the fact that we have prepared, you cannot really be prepared for that. And to me, this is the peak of my doing as a provider. It's like the highest achievement, not in the sense of being proud of it, but in the sense of knowing that you did something that means that you've been there for another human being. So as for the collaboration, we are connected to several institutions here in Australia, to some of the children's hospitals, but also to adult hospitals. I'm not going to go through the names. We have or a lot of research programs that are collaborative, where researchers on both ends perform studies together. We have training programs. One example would be the fact we talked about how strong we are in innovation and integrating innovation into healthcare. So teams from Israel are teaching Australian teams how to build innovation from within in the healthcare system. So there's a lot that is going on, and hopefully there will be more. I have to tell you that it's becoming more and more difficult. It's not that easy to Australian institutions to receive help from Israel. It's becoming a challenge. And again, part of my being here is to try and push through that resistance. And all that we do is at the end dependent on resources. Our world is such that without resources, nothing gets done. And the way we operate is dependent in these areas on philanthropy. So the care that we give patients in Israel is financially supported or backed by the government. The Israeli health system is very national. It's very available. People don't pay to get the excellent care that we give. It's free, or almost free. And that's covered by the government. But everything else that we do, the research, the innovation, the mental health support to the nation, the collaborations with other countries, our ability to send humanitarian missions across the globe. It's not just to Australia. We've been to the Ukraine, we've been to Samoa, we've been to anywhere where help was needed, and we were able to make a difference. And all of that is made possible only by collaboration and support. A lot of it comes from Israeli philanthropy, most of it, but a lot of it depends on our partners and friends around the world. And this is what the Friends of Sheba organization here in Australia is doing, is making these connections and helping us exploit opportunities. It needs to be seen. It needs to be declared. It needs to be clear to everyone that we stand together, and that it is recognizing the good parts, the right parts, the just parts of what we are all about. And Sheba Medical Centre and healthcare in general, not just Sheba, but the other organizations in Israel, that all we care about is mankind and doing well and doing good to one another, to other human beings, are the best possible way to demonstrate that.